Hello everyone, Supervisor Jim Desmond here on Monday, July 13th with a San Diego County COVID update. Unfortunately, I just watched the governor's press conference where he calls it a dimmer switch. You know, where he's dimmed it down so far that many businesses are now going to have to probably shut down in the state of California. And to me, in my opinion, he's doing it on false data and false pretenses. You know, he's saying that the testing, there's more and more positive cases. Well, out of those, we're doing more testing, so we're going to get more positive cases. He doesn't say, 85% of the people that test positive have no symptoms, and that 15% that do have symptoms are mostly mild. He said there was a 20% increase in those testing positive. It went from 4% to 7%. And he's calling that a 20% increase. To me, you still got a 93% chance of not getting the virus, and then you've of testing positive with the virus, even a smaller amount being hospitalized, and then even a smaller amount, those unfortunately that die from the disease. This is a knee-jerk overreaction to positive case testing in California. Another statistic he threw out there was the fact that our hospitals are being overburdened and overcrowded. In San Diego County, our hospital capacity has stayed steady at about 65 to 67% and remains there today. There has been a slight uptick of about 150 more patients with COVID in the hospitals, but 150 out of 3.3 million people is a 0.0000% of an increase in San Diego County. And for us to be shutting down sectors of businesses, those businesses include fitness centers, worship services, offices for non-critical sectors, personal care services of hair salons, barbershops, indoor malls. It's crazy what's being shut down now. I've not heard of any outbreak at a hair salon or at a barbershop. Technically, they could give haircuts outside, maybe in their parking lots, but they can't do any of those activities indoors. Our hospitalization, back on that, our hospital bed capacity in San Diego County, we've got 1,225 beds set aside for COVID. 1,225 beds out of over 6,000 potential hospital beds in San Diego County. At the highest peak was 493 COVID beds, and that was on July 29th. We're about 466 right now. We have over 1,225 available COVID beds, and we have not even got to 50%. And that includes the people from Mexico and the people from Imperial County. We haven't even hit 50% on those COVID beds. Our ICU numbers have gone up, minutely as far as the number of people in the ICUs. But it's just crazy the data that the governor is using to shut us down, to lead with fear as opposed to with data and with the facts. I'm trying to offer common sense solutions based on the actual data. We have not seen those types of increases in San Diego County. We've only seen outbreaks in restaurants and bars, yet he wants to close down gyms. We've only had one outbreak at a gym. Our restaurants and bars have had those outbreaks. We should be knuckling down on those, the ones where the outbreaks are occurring, making sure they've got the protocols and everything else in place. But to shut down entire sectors again is really just killing the workforce, killing jobs, killing the middle class and small businesses in the state of California. If you can tell, I'm upset over this latest knee-jerk reaction by the governor. We're still holding at about 7%, or actually 6%, over a 14-day period of testing positive in San Diego County. We have heard, because we have done so many tests, it's about 8,000 a day, almost 9,000 for the past 4 or 5 days, tests per day, when it was like 5,000 or 3,000 about a month ago. We've come to an understanding now that we're running low on testing capacity. So now our testing is probably going to be more focused on those with the symptoms. What does that mean? That means our numbers are going to go up again. We know this virus is out there. We know also who are the most vulnerable. That's the people that have underlying conditions, that are 65 and older. And our average age right now for testing positive is 39 years old. And those people are not getting violently ill. We have to protect the the elderly with the underlying symptoms. But this knee-jerk reaction of closing businesses again is devastating to our economy and devastating to the state of California and the county of San Diego. Thanks for checking in. One other thing I just wanted to bring up is San Diego Unified. San Diego Unified has notified put out that they are not going to have in-classroom school. So it's all going to be online, which is actually going to further hurt people getting back to work because they got to be at home and be the teachers for their children. And not every parent's equipped to do that. And so, quite frankly, I've heard from experts also saying we've got to get our kids back in school. They have the least amount, of negative outcomes or even deaths, from kids, under 18 getting the virus. Even if they have it, they fight it off, and very few of them ever die from it. I think there's been only a handful in the entire country. I don't want any death is important and a tragedy. But we need to get our kids back in schools. One of the reasons is teachers actually see changes in behavior of children much sooner than maybe their parents would report. They see, unfortunately, sometimes kids show up with bruises. Sometimes their attitude changes. They show up wearing gang clothing. They're the first ones to usually report and notice those types of changes in kids' behavior. Unfortunately, that won't be happening if schools aren't holding classes. So we need to get back to normal, folks. We need to fight this virus. We need to protect those most vulnerable. We need to use the protections, but we need to get our economy back and not keep going to these knee-jerk reactions, which the state of California is doing. Thanks for checking in.